Hello, everyone. Welcome to today's webinar, Promising Practices Supporting the Mental Health of Diverse Student Populations. My name is Jessica Ornstein, and I'm the Senior Manager of High School Programming at the JED Foundation. We are very grateful that you can join us today, and we hope today's presentation is helpful for you as we continue to be flexible and adaptive in this uncertain time. Each and every student and professional attending today's webinar is uniquely impacted by the pandemic and civil unrest that has occurred this year. And we hope that the resources and content shared today will help you and your community respond in caring for your students from diverse populations. Before we begin today's webinar, I'd like to share some quick administrative tips. One, we would like to point out that the information provided in this webinar is not intended to be a substitute for or to be relied upon as medical advice, diagnosis, or treatment, nor is it intended to be a substitute for or to be relied upon as legal advice or counsel. This webinar is being presented for informational purposes only. This webinar will be recorded and the recording will be made available to all registrants in the next day or so. Two, if at any point you have a question for our presenters, please type it into the question box on your dashboard. We will answer questions during our live and extended Q&A at the end of today's webinar. As a reminder, today's webinar will be recorded for all who attend this live session, and the video recording will be sent to all registrants in the following days via email. This webinar will also be accessible via JED's online mental health resource center. For those of you who are unfamiliar with the JED Foundation, JED is a nonprofit that protects emotional health and prevents suicide for our nation's teens and young adults. For example, through our higher education program, JED Campus, we partner with over 300 colleges and universities through our higher education across the country to guide them in a 4-year collaborative process of comprehensive systems, program, and policy development that builds upon existing student mental health, substance use, and suicide prevention on campus. We are excited to co-sponsor this event with McGraw-Hill. McGraw-Hill works with colleges and universities, nonprofits, researchers, mental health experts, families, and young people to promote programs and strategies that build understanding and assistance for the education, mental health, and emotional health of the nation's youth. In this webinar, JED's Chief Diversity and Inclusion Officer, Dr. Sofia Pertuz, and I will moderate a panel discussing strategies and sharing tips and advice with faculty and students on how faculty can provide support for students while keeping in mind the needs of particularly vulnerable student populations. As colleges and universities navigate the constant changes in communities due to current events, including COVID-19 and race relations, we recognize that there is much stress and anxiety on college campuses. First, I would like to introduce my colleagues at the JED Foundation. Dr. Sofia Pertuz is the Chief Diversity and Inclusion Officer and Senior Advisor for JED Campus. Sofia joined JED in November 2018 with over 20 years of experience in strategic planning, assessment, inclusive excellence, and critical incident management in higher education. JED's Senior Clinical Director for High School Programming, Dr. Suzanne Button, joined JED after 20 years of working with adolescents, children and their families, and the systems that serve and educate youth. She is a licensed clinical psychologist in New York State. We are also pleased to be joined by a wonderful panel who will help guide today's discussion. We want to thank each of them for taking the time to join us, and at this time, I will quickly read their bios. Dr. James Holly, Jr. is a native Detroiter who earned his bachelor's in mechanical engineering at Tuskegee University, his master's at Michigan State University, and his doctorate in engineering education at Purdue University. His personal mission is to invest in the prosperity of Black and urban youth by helping these young people develop their physical, mental, and spiritual capacities so they may become mature individuals and active members of society. Through researching and designing educational experiences that stimulate young people's intellectual growth, cultural competence, and socio-political consciousness, Dr. Holly Jr. is able to fulfill his mission. His dissertation focused on studying and implementing socio-political teaching when instructing Black boys in engineering. His doctoral study was unique as it trained the boys to think like an engineer, not necessarily to become an engineer, thereby developing transcendent critical thinking skills relevant for any career pathway or aspect of life. Shannon O'Donnell, Senior Marketing Manager at McGraw-Hill, earned her bachelor's in political science and her master's in intercultural communication from Illinois State University. Her research and work experience prior to joining academic publishing focused on teaching and program development. She was the first full-time employee to globalize a US-based mental health services company in over 100 countries. Today's presentation blends her passion for cross-cultural awareness and mental health with success in and out of the classroom. And with that, I'll turn it over to my colleague, Sofia Pertuz, who will go over today's agenda.
Thank you, Jess. I'm not sure what's happening, but I know some people are giving us a signal that the sound is not working. So if your sound is not working, please send us a note. On my end, everything looks normal. So I'm really sorry if you're not able to hear this. Hopefully the recording is coming through with no issue, and we'll be able to send you the recording after the fact. So we apologize in advance for that. Again, on our end, it looks like the audio is in order, but it seems like some people are not able to hear. So our apologies for some technical difficulties there. But thank you for joining us. We really appreciate that. A few items we're going to cover today. We come to you as administrators, as parents, as everyone who has been working through many changing situations in the last 6 months at least. So we already did introductions. We're going to talk about faculty and vulnerable student communities, student wellness from a distance, identifying students in distress, and everyone here will share some tips and ideas on how to better support students. So some questions that we have that we've been grappling with for quite a while now. How do I effectively shift from in-person instruction to virtual and back? We know that many campuses have had to shift not only to virtual learning, but to some kind of iteration of in-person and remote, and sometimes going right back to virtual. So we know that that's been challenging. How do I assess student academic performance? You may have been used to student attendance as a major factor. You may have been looking at discussions and in-classroom engagement. So how does that look if that was part of your pedagogy? How do I make sure that the coursework is as accessible as possible? As we know, technology doesn't always work the way we would like it to. So unfortunately, that may impact the learning process and the teaching process. How do current political events impact my students and colleagues? That's definitely a concern. Can everyone just sit in the classroom and concentrate and really focus when we have major racial tension that's impacting all of us? What are the resources that I can share with students about their mental health to support them? And how do I help students and myself handle overall uncertainty? And so many more questions. So hopefully we can answer the questions you have, but also some of the ones that we presented here. I'm now going to turn it over to my colleague at McGraw-Hill, Shannon O'Donnell, who's going to share a little bit about McGraw-Hill. Thank you.
Thank you, Sofia. McGraw-Hill works really hard to provide students and professors with support at every step. And usually when people think of us, they think of textbooks or online resources when we say support, but we also support the academic community in ways outside of these areas. As you can see on the screen, this is one website that's available to you to access at any time with different tips and tricks for faculty and students. Our partnership with the JED Foundation is another example of this. As you know, this is a stressful time for college students, as it is for all of us, and we want to do what we can to help. We're very excited to partner with the experts at the JED Foundation to help bring their information and resources to a larger audience. So thank you, JED, for your partnership and this webinar conversation, and Dr. Holly Jr. for your role on today's call. Back to you, Sofia.
Myself. Thank you so much, Shannon. We really appreciate your partnership again. So just to share a little bit about JED again, we have many signature programs that you can find on our website. So we won't go over it too much because we want to definitely leave time for Q&A, but we do have our signature program, JED Campus. We work with colleges and universities all over the United States and Mexico also, and Ireland. We also have U Lifeline, an online program. Half of us. Set to Go is a transition program, thinking about transition from high school to college life, and Love is Louder, and also Seize the Awkward. So I have a few slides where we have the websites indicated for these. So we hope that you can take a moment to check these out when you have a moment. We have plenty of resources there and a resource center where you can find articles and links to webinars that we've held in the last few months and the last few years, actually. So we hope that you can check those out when you have a moment. So just to share a little more about JED's comprehensive approach to mental health promotion and suicide prevention at colleges and universities. We believe that everyone on a college campus is part of the process and part of the support system and network that students can hopefully take advantage of. And we look at this from 7 domains, and strategic planning being the main one, but fostering connectedness and belonging, creating opportunities and systems, reducing shame and secrecy, ensuring that the policies are in place and protocols are in place that are able to handle crises, identifying and limiting access to dangerous means, and developing independent living skills and social emotional learning skills. So all of these are in our domains. I will talk a little bit about how they might show up when it comes to distance learning and when we're trying to do virtual education. For example, with our promoting social connectedness domain, students right now are experiencing a sense of loss because they're not having the same kinds of connections. They're likely connecting online and on different apps, but there's something different about being able to engage in person and go to meetings and really speak to each other face to face without a mask. Time zones may impact participation. If students were forced to go home because they can no longer engage on campus, they may have to think about what kind of time zone they're in to be able to participate, especially if you have synchronous classes happening. In terms of developing life skills, many students are challenged by unique life circumstances and distractions due to microaggressions. So this is something that might still show up online, just in a different format. We want students to increase their health-seeking behavior, so access to care may be more difficult. There may be across the line, state to state regulations that might cause issues with how students may access the counseling center. And then there might be lack of knowledge on where and how to find the information, if there is easy and accessible online and telephone care. So we're hoping that schools will share as much information about these as possible so that students still know how to access information and the resources they need. And then the final 3 we'll talk quickly about is the identifying students at risk. It's easier to identify a person in person when you see behavior and how someone's dressing and how someone's looking every day. Online is difficult because, as if you're going to be on a computer all day, you're not necessarily always going to get dressed up. So it might not show up the same on a screen than it would if someone was sitting in your classroom consistently. And it may present in different formats. Providing mental health and substance use services would be also a challenge, but there are ways to do that through telephone, through telehealth, but there may be some fear that confidentiality is compromised if someone's at home and is not having a moment of privacy or a place where they can go quietly to respond to the care. They also are hoping that they get access to culturally responsive care. We're always thinking about that when it comes to vulnerable populations. And then finally, following crisis management procedures, shift in procedures, there may be a different way of thinking about, do you still call law enforcement if someone is home and you're trying to figure out how do I do that without risking or thinking that a student might be even more at risk or might not be able to access services in the same way that they would when they're on your campus and you have a little more control over the process. So that's a few ways that we think about our campus domains and the considerations for remote and online learners. Sometimes people think that faculty are not interested in being there for students or providing emotional support, but that's not true. And we have found that in our research, actually faculty are fully available and able and would like to be helpful, but they sometimes just don't know how. So hopefully today we'll talk a little bit about, and hear from Dr. Holly and our panelists about this, about ways that faculty can reach out. And then this is broken out by gender, the responsibility to students' emotional health. So hopefully this is good data to show you that faculty indeed do want to help, and they are wanting to be supportive to students, especially during times of distress. And what are the vulnerabilities during quarantine? Clearly, there's a lot of different students that are impacted in ways that are more pronounced than other populations. So for example, international students, students of color, queer spectrum and trans spectrum students, students dealing with violence in the home, food and resource insecure students, students who are caregivers to children or elders, students with disabilities, students who are managing anxiety, depression, and other students who are military connected, and so many other vulnerable populations. And we can talk through those a little bit too. Then there's also, like we mentioned before, resource insecure, but thinking about who out there doesn't have the same kind of online access and can't participate in class as everyone else. So that's something that college campuses are really thinking about and responding to, but something to keep in mind. I'm now going to turn it over to Dr. James Holly Jr., who's going to talk about healing-centered teaching and ways to humanize the virtual classroom. Thank you, Dr. Holly, for joining us today.
You're welcome. It's my pleasure, and thank you all for allowing me to be here. Also, thank you to Jessica and Shannon for actually saying the junior. A lot of times, so it's just James Holly, and so my Twitter handle is please say the junior. To the audience, thank you all for being here. Glad to have this tremendous opportunity to be amongst other very intelligent people who have done great things that I'm able to be in conversation with. I wanted to spend time focusing on or talking about what Dr. Sean Jimwright calls healing-centered teaching, really engagement. But since I'm faculty, I'll talk about the teaching component. And given that we're talking about the virtual classroom, what I wanted to think about is, one, what brought us to this space, and then how do we navigate this space collectively, right? And so I will say that the tips I have are mainly through the framework of thinking about Black students. That's most of my work, that's my own identity, and that's where I'm mostly situated. But surely there are things that can be applied to other identity groups as well. But I want to start by just saying the trauma being experienced on a global level is the pandemic, right? But what about the pandemic? What has happened? What has the pandemic done? And what we've seen is, at least at the forefront, the numbers have kind of shifted. But early on, when numbers started coming out, we saw there's a disproportionate fatal impact on Black people, Black families, Black communities. And so while a lot of conversations about school, you had children, adults, and just people in general grieving in an isolated manner, while there being decisions made and society wasn't really trying to hold up the demands at the collegiate level nor the pre-college level. On top of that, you had the inundation of anti-Black violence, seeing Black people murdered and brutalized by police, by other civilians, and protests and unrest. There's various things happening. And so while those things aren't new, it's reinforced, it was heavily perpetuated throughout the media and conversation. And so you're dealing with the assessment and evaluation of what your life means, or the value or lack thereof of your life, still dealing with the pandemic, right? And then whatever individual circumstance that people had to navigate. And so with that, I highlight this quote: a healing-centered approach views trauma not simply as an individual isolated experience, but rather highlights the ways in which trauma and healing are experienced collectively. And so it really transforms away from saying, how are you navigating things, from how are we all dealing with this? And I think the fact that the pandemic is global, it helps us better conceptualize what that means. But as faculty in the classroom, I have to then say, well, I'm dealing with it my way, or you're dealing with your way, but how are we both, dealing with the situation, but also how the way that we manage it influences one another. A lot of things that I saw or encouragements you can hit the next slide, sorry about that. A lot of things I saw were like, students, be patient with students, be gracious, be merciful, be mindful. And then faculty, well, what about us? Like, we're going through this as well. And so the ways in which we collectively navigate is very important. So here's a few ways to do that. One, giving students the opportunity to individually check in. What I mean by that is, in my course, the way I demonstrated that, the first meeting, September week, the first session, just how are you all doing? We meet, we alternate between meeting asynchronously and synchronously every other week. And with that time that we had synchronously, I have an hour and 50 minutes. I just wanted to hear how they were doing. We could talk about the syllabus, that'll be there. We can talk about the assignments, those will come. Surely they will come. But I just wanted to get a sense of how students were doing and be responsive to that, right? So the second point of the second sub bullet point says creatively shift course structure while maintaining course expansion. So if students aren't doing well and they're communicating that, I have the responsibility to modify the way the content is presented without necessarily reducing the quality of the content or limiting or lowering the expectations of the student. But we have to acknowledge, like I said, that racial trauma or trauma around gender identities or trauma around whatever the issue is that has been promulgated through media, but also personally experienced. And there's some things that we may not know, right? That students don't have to be held. They don't have to tell us all their circumstances. I had a student whose mother passed within, I think, about 2 weeks ago, and she had been navigating that since the beginning of the semester. So I have to figure, how do I, support her, right? In my particular role, but also be sensitive. Like, I still want you to learn and do these things, but if you need time, if you need to step away, like, let's work together collectively. And I think a lot of times there's an antagonistic relationship between the professor and the student, where, which was mentioned earlier, the encouragement, increasing help-seeking behavior. That's one of the points of emphasis for JED. We have to be facilitators of that, right? We have to create a context where students feel comfortable seeking help, because the broader point is that they don't. And we have to be intentional and explicit about, you can receive help, and create methods and pathways for them to get the help that they need. And then secondly, engaging students with asset-based framing. So again, not what's wrong with you, but highlighting what's going well. Thank you for coming into class, right? I think oftentimes we talk about, it's a demand. You signed up for this course, you want this information, you ought to show up. And that really, it creates a false context or dichotomy around whether a student cares or not. They signed up for the course because they care. They're in the university, they're enrolled because they care. If they don't show up, it doesn't mean that they don't care. Most likely it means that there's some of the barrier or circumstances they're trying to navigate. And if they don't care, allow them to communicate that to you. Let's not put that on them and force it. And so I think just saying, acknowledging what's well, I see you're trying, and if they need help, can you communicate with me, right? Instead of saying what's going on, what's the problem, offer them supports in terms of, reach out. If you notice someone is not engaging, send them an email. Check up on them in the private chat if you're in course or something in the class, but being intentional around that. And then lastly, affirming agency and restoration. And with that restoration is saying, there's a lot happening to us. There are some things that we don't have control over. For example, whether universities met in person, or what type of, I had agency in terms of selecting to have an asynchronous, a remote learning experience, and the students did not in that regard. However, I can help them in determining what they are able to do, reaching out, attending virtual office hours, sending me emails, using alternative measures or multiple ways of submitting their assignments. So those are just a few tips. I'm happy to talk further that I wanted to present today. Thank you.
Thank you, Dr. Holly Jr. So important to humanize the experience, for sure. So you shared some tips here, and we're getting some really good questions. So I'm going to turn it over to Dr. Susie Button, who's going to share a little bit about how to identify students in distress. What are those signals you can look for, and what are some wellness tips? So
thanks.
Thank you.
Thank you. You can go right to the next slide. So the other panelists have talked a little bit about this, right? There's a significant psychological impact to quarantine. And I want to say that these 4 things on this slide are only exacerbated by some of the other experiences that Dr. Holly Jr. and Dr. Pertuz have described. So increased anxiety, that is indeed a global experience. Increased anger, that's a global experience, right? The tendency to want to self-medicate in the face of some of those symptoms are global experiences. But for people of color who have other stressors going on, who had inequities coming into the pandemic, and who are watching the increased level of stress and trauma secondary to those inequities in terms of how it's impacting their life, these concerns are more significant. In addition, right, when we think about triggered PTSD, people with histories of trauma, right, are going to be more stressed and upset by a global pandemic. But there's also a level of race-based trauma that's being triggered by what we're seeing in the media and what we're seeing in some of our leaders and what's happening across the country. So there's a psychological impact, and then there are vulnerable groups who are experiencing more intense psychological impact. Next slide. So there's some specific stressors, right? And Dr. Holly Jr. talked about agency as being a significant concern. And some of the stressors have to do with an absence of agency. So we don't really know how long this is going to go on, right? We don't have a direction, a clear path out. We seem to see progress start and stop, both in terms of coordinated efforts on the part of government, where a vaccine is going, right? And we also see all of the systems in our world stopping and starting too. So there are lots of ways that duration is uncertain for young people right now. There's also the basic fear of infection, right? And this can be, it was particularly difficult at the beginning of the pandemic when people didn't have very accurate knowledge. There were a lot of rumors going around and people were very terrified. And now we have better information, but we continue to have risk, particularly when we have more vulnerable loved ones in our lives. And so that's a real stressor that's ongoing. Then there's that basic frustration and boredom stressor. These are young folks, their job in life, their developmental press is to move out into the world, deeply engaged with their peers, deeply engaged with other caring adults outside of their family. And here, all of that has been interrupted to some degree. And as Dr. Pertuz said, they're finding ways to connect online, but it isn't the same as life before the pandemic. And then I work with a lot of young people who talk about this grieving process, and they vacillate between those feelings of anger we talked about a little bit before and a real sense of grief that they've actually lost milestones, right? Some of the young people that we see who are struggling the most are the ones who are missing significant transitions during this pandemic. So young people who are going from senior year of high school to their first year of college, for example, or young people who are leaving college and moving out into the working world are another example, right? So there are milestones, there are opportunities, canceled semesters abroad or canceled internships, right? Canceled sports competitions. We have young people who've trained and pushed their whole life for the arts or for sports, and what they worked for has been canceled. And so those are important triggers for grief. But we're also seeing a lot of public figures die of COVID-19. Some public figures this year have died of other causes, right? And so significant role models, significant public figures for whom one feels connection, to whom one looks for role modeling, that's also going to bring up grief. And young people are going to be particularly challenged when they feel a strong identification with a public figure. One example of this happened recently. Many of the young people I work with really experienced a lot of grief when Chadwick Boseman died. He had so many levels of significance for young people. And in the past year during the uprisings, his dignity, the strength of his presence on screen, much of the work that he did off screen in his life gained even more powerful significance. And when he was lost, young people grieved significantly. And then we have some of the other pieces that we talked about a little bit at the beginning of this slide. We're not getting consistent information. And that is in part because of people in positions of power having a vested interest in distorting information, and also in part because the young people we're working with depend heavily on social media for some of their information. And there are algorithms that really divide what kind of information they're getting. So there's very little centrist, balanced information out there to help calm folks' fears. And then finally, it's very difficult to develop any kind of a sense of security when we have people in authority or power who are exhibiting behaviors that make it very hard to trust them, and who are exhibiting behaviors that incite hateful behavior and racism, makes it even harder for young people of color to feel safe. So Dr. Pertuz mentioned some of this as well. There are also financial stressors, right? Young people that you work with may have lost their own working opportunities, but they also may have family members who are experiencing financial losses, right? There's a lot more food insecurity and housing insecurity going on right now. People are losing jobs. The unemployment rate has gone up, right? And then there's also stigma. So there's sort of a few different kinds of stigma that young people are struggling with. One is we hear a lot about the stigma of COVID-19 itself, right? That if you have a family member with this illness or you have this illness, it actually can be even more isolating because people are afraid to come near you, people are afraid to support you and connect you. But then we have the ongoing issue of stigma around mental health issues, right? So when you feel anxious and when you feel depressed and when you feel triggered, your trauma history, your race-based trauma history is triggered. Do you have trusted others that you can openly speak to about your troubles? Or are you in a situation where stigma makes you hesitate to reach out and get help? Now, even when the post-isolation world opens up, even when kids go back, my own teenagers this week went back to what's called hybrid learning, 2 days a week, right? Some of what's happening for young people when they begin to reapproach their normal experiences is they realize more what they've missed in all this time. And so additional feelings of grief can arise. And finally, there's a new normal emerging. And we talk about this quite a lot at the office at JED. We don't know what that new normal is going to be like. We don't know. Will we be able to hug each other? Will we be able to go to a ball game without our masks on? Will we be able to cram all of our friends into our living room to watch the Super Bowl without masks on and yell our heads off? We really don't know what's coming. And so people are experiencing ongoing stress about what that's going to be like. And as that shapes up, it's going to be stressful. So given all of that, we want to sort of help you think through some layers of self-care. And as Dr. Holly Jr. said, we want to encourage you to think about asset-driven healing, right? So thinking about ways to support yourself and to support your students. And the first really is that old corny oxygen mask metaphor, right? And that is that you cannot offer oxygen to your students until you put the mask on yourself. And so we want you to be thinking about your own self-care. How are you finding ways to reach out to your trusted others? How are you finding ways to exercise, to sleep, to eat right, to make good decisions about your health and well-being, right? That's one. Number two, how can you integrate, talk about, and role model tips for self-care into your work with students? As Dr. Holly Jr. said, there are lots of ways to reach out. And one way is to say, look, this is a tough time for all of us. Here's some ways that I'm working to take care of myself. Let me talk to you about them. What are some of the ways that you're taking care of yourselves, right? Make that part of your daily lectures or your PowerPoints. When you're worried about a student, ask the student if the student is okay, right? Do it privately. You can privately chat, as Dr. Holly Jr. said. You can reach out to the student via email. But remember, when students are acting out, that should also be a trigger for concern. So when a student is, as Dr. Holly Jr. said, not showing up for class, not participating in class, not engaging with you, right? If that's happening, reach out to that student and reach out not to say, where were you today, but to say, hey, you weren't in class today. I'm just wondering how you're doing and if you're okay. Another piece to really think about is the principles of active listening, right? So we want to hear our students on 3 different levels. So when you're in graduate school to become a psychologist, they teach you to think about process and they teach you to think about content. So content is what I'm saying. So I may be saying, wow, this has been a really busy day. Or, wow, I can't keep up with my work in your class, right? But the emotions that a person is feeling come through the content. Now, as Dr. Pertuz said, it's much harder to read emotions via an online communication. So sometimes we have to explicitly ask, well, how is that for you? What's going on that the workload is hard to keep up with, right? But we want to get at how students are feeling on top of what they're saying. And we also want to find out a little bit more about how students are behaving. What are they doing with the feelings and the challenges that they're encountering? And we can sort of ask about that, hear and listen, reflect back, and then offer some self-care tips. So here are some little tips that we'd like to offer when the young people in our world say that they're not okay, right? So no, Professor, I am not okay. I am not sleeping. I am stressed out. I am anxious. I feel angry. I don't know where to turn. So what do you do with that? How do you help? Well, the first one is reflect back that you care about them, that you appreciate what they've shared with you, you appreciate their courage, and that you want to be helpful to them. One of the things we actually know about suicide risk is that one of the predictors of suicide risk, in addition to struggling with depression or another symptom of psychiatric illness, is that people who attempt suicide feel that they are alone. The most important strategy that faculty or staff can offer to young people when they share stress and distress is to say, you are not alone. This is a really tough time, and I'm here to be helpful to you, right? So we're in this together. I'm going to be helpful to you. And to provide guidance to the student for anything you're qualified to offer guidance for. So remember, by saying you're not alone, we're not suggesting that you become a student's therapist, right? We're suggesting that you walk through things that you can be helpful to them on, right? As Dr. Holly Jr. said, think about assets, think about coping, walk through study skills, time management, anything with technology or formats, or do they need time? Do they need to step back? Will you helping them make a plan to keep up with the coursework help them feel better? Or would a break from the coursework help them feel better? And then importantly, make sure that you know where to find support services that are adapted to the virtual environment in your institution, right? Most colleges have some sort of central location where you can go to get that information. Make sure you have ready access to that. It also helps to have ready access to information for needed resources that are significantly related to stressors. So for a food insecure person, how can you point them to a resource that will get them fed? For a housing insecure young person, what are the opportunities for shelter? And for students who are experiencing domestic violence in the home or abuse in the home, or someone in the home who's using substances dangerously, what are the resources that you can connect them to make sure that they're safe? And just to really remind them, both as a pedagogical piece of content in your daily course presentation and in your individual responses to youth who are struggling, that good self-care will help them learn, it will help them cope with the suffering, and it will ultimately serve them well in the long run as they grow up. So this is really a tricky piece, I think, because the current resources for your institution are likely changing from day to day. We talked in an earlier slide about how everything's ambiguous: in-person learning, out-of-person learning, on-site services, off-site services. So keep in touch with the counseling centers in your school. Make sure that you know what the options are for students in terms of digital services, right? Many counseling centers are moving to digital platforms. Many mental health professionals are getting emergency licensure in different states so young people can stay connected to their mental health professional in the community where they go to school, right? Keep in touch with that. You know, get a list of campus food banks, take out meal plans. Make sure that you have an understanding of healthcare resources, typical healthcare needs, right? And make sure you have an awareness of financial aid services for loans, employment, emergency money. Really important is to know where to point students for transition support. We talked a few minutes ago about how those transitions are very difficult. So what are the career services, virtual or in person, depending on where your campus is at, that you can send students to when they're expressing concern and fear about a transition? What do I do about next year when I'm graduating? Where do I go for an internship? Are there virtual internships? And what about study abroad? Should I even be thinking about that? And never be afraid to say you don't know but it helps the student know you're in it with them to say, you know what, I don't know, but I'm going to reach out to my contacts on campus and I'm going to find a resource for you. Again, never making a student feel as if they're a burden, always letting the student know you're willing to be helpful. So this is an important slide because you may actually be, or other online faculty may be, a student's only connection to your institution right now. If the young person has not been connected to other things, the counseling center, clubs, teams, peer groups, right? They may have you as their only contact. So we don't want you to be everything to them, but we want you to think of yourself as a potential bridge to all the resources that are out there that they might need. And so that simple willingness to listen, to hear all those levels of what a student is saying, and to be able to connect them to the right resources is a powerful support that you can offer to the young people in your school. So let's double back to self-care for you. We know you know this, but we want you to go through this list and ask yourself, are you actually doing it? So sleep, healthy nutrition, and exercise, right? All of us have our healthy and unhealthy coping strategies, right? And we need to be more mindful about creating structures for the healthy ones. One of the things I'm struggling with is that Zoom makes me very, very sedentary. And at the end of the day, when the sun's about to go down, if I don't get on my sneakers and get outside and take a walk, then I'm going to miss that opportunity. And all of us have to think in a fairly disciplined way about how we can work that self-care into our day. Create those structures for your days and weeks. Minimize your unhealthy strategies, maximize your healthy strategies. We were talking when we were getting on the webinar about kids running around behind us during our Zoom meetings, right? And so it depends. Some people can teach with that going on and concentrate just fine, and others can't. So set up a dedicated space that helps you feel comfortable teaching in the virtual environment, right? Don't, if you can help it, don't set up a situation that's going to stress you out, right? Now, we just told you to be a good bridge to students, right? And to be there for them. But we said we don't want you to be there for be all things to them. And we also don't think you should be there all the time. You need to set limits so that you have that self-care time, that time with your caring others, your significant people. So set limits. What are the times that students can contact you? Put digital office hours in place so that you're not constantly, right, inundated with requests and asks. Set some limits around yourself. It's also important to manage demands from others. Dr. Pertuz and Jessica, we're all got to work on this together, right? So lots of people are making lots of demands, and in some ways the Zoom environment speeds everything up, right? Makes it easier to ask of one another and not think about workload because we're not working in the same space together. So manage your demands, right? Set time limits, right? And find time for yourself. And I think the most important thing that we can think about is reasonable expectations. When I think about reasonable expectations, I like to say 3 times: compassion, compassion, compassion. We're not going to be uber super parents. We're not going to be uber super professors, right? We're all doing the best we can. This is a new situation. And when we bring compassion for ourselves and how we're coping to bear, we're going to be that much more compassionate with the people around us and with our students. And that compassion leads us to be more protective of space and time for caring for self and being with others who feed us.
And with that, thank you so much, Dr. Holly Jr., Dr. Button, and Shannon. Jess will entertain us with some questions. We have a few actually really good questions coming through from many faculty out there who have need some tips and advice. So Jess, do you want to go ahead and jump in?
Yes, I'll take the first question. Excuse me for the echo. I'm sorry, everyone. So the first question is, as a professor for many years, we work tirelessly convincing students to take advantage of services offered on campus, such as counseling or career services, etc. Other than taking students by the hand to any of these areas, how can we all, on the post-secondary level, convince students to take advantage of these services?
Well, I want to say a couple of things. Actually, I forgot to do earlier. Is one, I focus on urban STEM education. So I'm in college of education. My focus is STEM. So also, this is a space that's very traumatic for students with the content dealing in science and mathematics and things like that. And then secondly, I would say that healing center engagement is a revision to trauma-informed engagement and learning. And so if you all are familiar with that at all, but I would say, you know, that's the increasing helping seeking behaviors. And so I think you have to create a culture or be willing to be intentional and stick your own neck out there to open it up for students. Because I think the folks in CAPS, like they're sitting there waiting, or our psychological and counseling and psychological services office are sitting there waiting, like, people, please come, please come. But there's stigma around those things. I'm thinking, speaking specifically from what's known about Black people in counseling and those type of therapeutical services. There's a stigma that you have, that you only go there if something is wrong. But the way our culture is you're not supposed to talk about something that's wrong, or if something is wrong, you need to go somewhere else or do something else. And so you have to creatively find ways to have those conversations where wellness is not just about if something is wrong, but rather how do you make sure you're being your best self. And so some of that comes from creating a community culture in your classroom where you get enough information. None of us will fully know students within the semester or even the full year, but you get enough about the students to know when they're not being themselves. So if you have a student who normally speaks up a lot and then they're not, you have to reach out either through the inbox, the chat, the, hey, can I talk to you? Whatever you can do to get a conversation with that student. Other times there's just their students' work, right? You have to assess whether or not you feel that this is their best representation, or if they can, or there's been a shift. For the early semester, they were going really hard and providing high quality work, and then it changes throughout. And so we have to make that a part of our responsibility. I mean, some of that goes to speaking with those professionals to ask them for tips on ways that we can, not, again, we can't diagnose, we're not experts, but there are strategies that we can use within our classroom to be more sensitive to at least signal and flag things. And I think the stuff I said, I don't think was really high level or complex, but is absent, right? Allowing students to check in. A lot of times people start class and they just get into the content. And there's not room in the structure and the syllabus even to skip spend more time, revisit something, or even skip something so that students can recoup.
There's a good, sorry, Sophia, where you going to go? There's a good follow-up question here.
Yeah, no, there was one that I definitely think we need to address. Somebody said, wonderful advice, but all 3 of my classes are not only online, but asynchronous. So I think the question there is, how do you reach out and find out what's happening with students if you don't actually see them all the time on Zoom or any other platform?
Yeah, so I was having a discussion earlier today, because I think being in person and even synchronous, like we know that human interaction face to face is optimal, but it's not the only way, right? And I think it takes a shift of paradigm to say, okay, I'm not going to try to replicate what I did in person in synchronous and asynchronous environment, but at least at my university, we have an office for teaching and learning, and it's their job, literally their job, to help me do better asynchronously. And I think looking for those resources and those strategies where I'm not trying to do in this context what's in a different context, but find out what are the most effective ways to do remote and online learning, because it's not new. It's just been forced upon a lot of us, right? And so we have to find the agency that we have to say, I'm not going to do things in a similar way. And I think that's a knock on you as a professor or anybody else. We've been forced into this context. But I think the way that we get through it is not to say it is asset based, right? It's not about what's not working or what doesn't work, but where is there some interaction? Are students engaging at all? Are they doing the discussion boards? Ask students to do videos, or you do a video, so that you kind of, there's an app called Marco Polo my wife uses a lot. And with that app, I don't like, I wouldn't want to do it, but what it does, it simulates, it humanizes text messaging, if you will, right? And what the app does is you record a video and you're talking to the person. You're not talking with them at the same, it's not synchronous, it's asynchronous, but you're seeing the person, right? And the person is seeing you, and you're doing the same thing you would through a text message. And so I think we have to try to figure out what are the ways we can replicate such models. But if you have students who are not engaging, I mean, there has to be some engagement, right? And so that's a very limiting barrier or context to be in. And I think, at our university, we have the student's phone number. We can call them. I would say do so in a reasonable hour. But I had that issue. Actually, I'll speak of the issue of that. The student whose mother passed, I was reaching out, asking her to get back with me. She was having issues turning in assignments, understandably so. She reached out to the program coordinators, but for whatever reason did not come to me. And so I had a more senior faculty member reach out to me and was asking how things were going. I was like, I can't connect with the student. And they're like, well, the student's phone number is listed so-and-so. And I was like, well, I wouldn't feel comfortable. It's across gender dynamics. It was in the evening. She said, okay, I'll call. She made the call and connected. And then, this number works. You call, had a good conversation with the student. So I called, left a voicemail. The student reached out via email. And then I called again later. And so I think some of it is really going to just cause us to be very active. And our role as faculty members has certainly changed. We have to take on more responsibility to lead in various ways.
Thank you for answering that question, Dr. Holly Jr. The next question is, can you recommend, anyone on the panel, can you recommend resources for healing-centered teaching? Is there a difference between it and trauma-informed teaching?
So Dr. Button, did you want to hop in since I'm talking a lot and I follow up, or? I got it. Okay, I like that. I'll take the floor. So it is different, and the different is the point of focus. So with trauma-informed engagement or teaching or whatever third word you use, it's about just being sensitive and aware. So it's like the student has experienced some form of trauma. How do I create a system to be sensitive to the trauma that they've endured and still be successful in helping them meet learning objectives or whatever the case may be? Healing center is just that, is moving towards wholeness. So it's restorative. So it's not just about getting the work done or being mindful or aware of what's going on with the student, but it's helping them figure out how they can work through the trauma towards a better a wellness, and mentally well and emotionally well and psychologically and physically well space, as well as signing on as a partner in that process to say that if you're not fully well, I, in an indirect way, cannot be fully well, right? So we are collectively, because you come into class, not your full self. And so I have to respond to that as a professor. And, I'm asking you a question and you're giving me certain feedback. It doesn't necessarily have to be negative. It could be no feedback, but it's not the best feedback, right? You're not responding in that way. And so it's really taking on some bearing of the burden, if you will. And in a different way, it's shifting from sensitivity and awareness to restoration. And finding strategies to really, so when you're teaching, it's about the design of your course. Is your course structure punitive if students don't do what you want them to do, or is it assistive, right? And so, and there's various ways to do that. Some people don't have late policies. You can resubmit, you can submit late. Some people, you lose deduction in points. Other folks like myself, I have a no late submission policy. And it's not absolute, it's really just kind of push the students and encourage them to communicate with me early on. But the reason I don't want them to submit late is because I want them to work ahead of time. And if they have an issue, which I explained to them, if something is due Thursday and you get to Tuesday and you're like, I'm not getting there, I'm not gonna make it. I would rather they send me a note saying, hey, this is not gonna be complete by Thursday. And then we work something out. When can you do it? Friday? Can we do Saturday? As opposed to they're so freaked out and nervous that they just either don't submit anything, they submit low quality work, or they submit it after deadline and they just say, well, it's submitted, right? So it's really about shifting your course design, your instructional practices, even it's in terms of submissions. Traditionally, the discussion board is overly used in online learning. It can be helpful, and there's definitely great ways to use it. But there are other ways of doing things where students, and also how they do complete assignments, right? So is it just written assignments? Can they submit a video? I have an assignment where I ask students 3 questions and I say either do 250 words or more, or a 3-minute video or less. We have another assignment that's an artistic picture. So they submit a picture, and they give me a paragraph describing the picture. So just creating various ways, because the student, as they're navigating that trauma, they need ways to see that they can still be successful. And you're not going to penalize them for the circumstances that they're navigating, the ways they're already being penalized.
I would just add that when you're thinking about trauma from a mental health perspective, some of the more powerful evidence-based ways to heal trauma in a therapy office are very connected to what Dr. Holly Jr. is describing, in that we do start with understanding the impact of trauma on a person's psychological and physical well-being, but we don't end there. We move then to helping people understand ways that parts of them have transcended trauma, parts of them have been strengthened by trauma, and parts of them have supported the parts that are wounded, so that the narrative actually of coping with, understanding, and moving forward in the face of, and even because of, the trauma in a different or new way becomes the healing path out of living 100% within a functioning that is trauma triggered. And so that approach, that asset-driven approach, we're finding is really powerful in many, many ways.
And I'll say, jumping again, Dr. Button talked about how we grow through trauma. I think that's an under-recognized reality. And it's not necessarily inevitable all the time, but there are opportunities for that. But I also think in addition to that, we also have to think about the ways that we train and socialize students by not giving them the space to endure their trauma, right? So this, again, going back to the student I had whose mother passed, I asked her, would you like an incomplete to continue to work next semester, and grieve, really mourn for the rest of this semester, or whatever the case. And she was like, no, I'll keep going. And I think that's the way that when talking to her, I could tell she was saying that because that's the way she's trained. That's what we train students. You just push through things, you suck it up, you exemplify grit and resilience. And also she's in an accelerated program. So if she gets off track, then it really disrupts the rest of the program. So she was just like, I got to get this done. Even if I could tell, or I had a sense that that's not what she would ultimately want to do. That's not what is most well for her to do. And so I think, what I did was say, all right, you take a week and a half, right? Like just take what time you need to experience, to deal with your experience. Then you come back and we create a game plan. So even though she's taking that week and she comes back, I'm not saying, all right, you're back in it, let's go, it's game time. No, we're going to figure out a plan that works for you so we can, again, still meet these objectives. I still need you to get this information, because if you're going to be a teacher, there's some things you need, right? I don't want to produce a poor quality teacher for the youth that she's going to be in front of, but also life happens, and we have to allow it, we have to humanize one another, right? To say that these things are out of our control, and free us to respond to what's happening.
All right. Well, I think that is all the time that we have for questions today. I just want to thank everyone for their time just participating in our panel. I want to thank everyone who registered for the panel and remind everyone that we will have an audio recording of the webinar that will be sent in the next few days. It will also be available on our JED website under our Mental Health Resource Center. Thank you all for your time. Continue to stay safe and stay healthy, stay well, and continue to support the students that work with you and continue to support yourselves. Thank you so much.
Thank you.
Take care.
Thank you.
We